On. Good morning. Thank you so much, everyone, for coming to the Public Health and Minority Disparities Committee for the Health and Government Operations Committee. Today, we have a couple of bills that we're going to go through. We will have council describe them. Then, as always, we'll have a discussion as a committee and see where we go from there. So thank you for making time for us. So Erin, will you be so kind and get us started? And Edith, thank you so much, Ms. Perry, for staffing the committee.
Okay, we're going to start with House Bill 547. This bill prohibits Medicaid beginning January 1st, 2022 from including a frequency limitation on covered prophylaxis care or oral health exams that requires those services to be provided at an interval greater than 120 days within a plan year.
And I believe that is Delegate Lewis. I usually allow people to say a few words. Is there anything that you'd like to say on this bill? And then I'm going to go to Robin Elliott.
I think I will just say this is a good bill, and I hope that you'll give it fair consideration.
Okay, Ms. Elliott.
And I'll just say I'm appreciative of having a good bill sponsor and wanted just to address, I know, an issue that the committee always is obviously concerned about, and that is whether or not there's a fiscal note. The fiscal note on this bill is DLS disagreed with the department and the one end of their estimate range is about $134,000 in general funds. That would be if this bill results in a 1% increase in preventative services, which I think it would be wonderful, is probably a little ambitious, and we're looking at below that. We do know, and we've got documents from the Department of Health that show as there's been an increase in the amount of preventative services for children, we've seen a corresponding decrease in the amount of funds spent on restorative care. So more teeth cleanings, fewer cavities being filled. And I'd be happy to answer.
It would be great, right, if they would get these preventive care, but unfortunately we know from Medicaid, and I'm on the commission, that people do not do it, you know, and these are a lot of the most vulnerable people that we have as well. And just as a question, this was done like in 2012 for the private insurance, wasn't it?
Yeah.
Yes.
Okay, wonderful. Wonderful. Are there any questions of the committee on House Bill 547? Concerns? Seeing none, may I have a motion, please?
Move the bill.
May I have a second?
Second.
Is there any discussion? All those in favor say aye.
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 Any opposed? I have, okay. How would let's just do Shalega, and who else?
I just got on the call, so I don't even have the bill up, so I can't vote on a bill. I don't even know what you're talking about. I'm sorry.
All right, so you know what, Delegate Shalega, since you came after we were all here, it's okay, we're still early. We will go back. Erin, can you tell Delegate Shalega what the bill does, please? We're not in a rush, Delegate Shalega. It's okay. Go ahead, Erin. I don't like to push anything. I want us to understand what we're voting for. Go ahead, Erin.
This is House Bill 547. It prohibits Medicaid beginning January 1st, 2022 from including a frequency limitation on covered dental prophylaxis care or oral health exams that require those services to be provided at an interval greater than 120 days within a plan year. There's discussion that this mirrors the current requirement that is applicable to private insurance plans for the frequency of dental health cleanings.
And there is a dispute in the fiscal note, Delegate, where the fiscal writer disagrees with the department just because it would be ideal if 1% were to increase and get the services, but we know they do not. And we do this for the private sector, and this is a community that is most vulnerable, and that's basically it. Any questions that you may have?
So what, the fiscal note, can you tell us again, you're disagreeing with the fiscal note? Is that?
Delegate Elliott, Robin Elliott, I'm sorry, Delegate. Ms. Elliott, will you be so kind and address the fiscal note? I promoted you or demoted you, however you want to see it. Can you please address that?
Yes, and I used to love working with Delegate Elliott when he was serving. So the fiscal note writer disagreed with the department's estimate and said that that there could be a range of a fiscal impact. So what the bill would do is just allow you to go in a little bit earlier for your cleanings and oral health exam, but you'd still just get 2 a year. So we're hoping that a few more people were able to get preventative services. What DLS said is that if it were at 1% increase, which would be incredible, it would cost $134,000 in general funds. We don't think it'll result in that big of an increase, but that provides us some background as to what it could be if it ended up being really successful. We do know that as Medicaid's increased the number of kids getting preventative services, they've seen a decrease in the number of children requiring more expensive restorative services, which are essentially filling cavities and things like that. So I'm happy to answer any further questions.
Any other questions or concerns? Okay, so we had it was moved and second. All those in favor say aye.
Aye.
Any opposed? None opposed. The bill passes is unanimous. Thank you, Ms. Elliott, for your time today. Erin, will you be so kind and go to the second bill, please?
House Bill 549 codifies the process that is followed to register a birth certificate for a child who is born using a gestational carrier. In any case that involves a gestational carrier in which parentage is determined by a court of competent jurisdiction, certain information has to be recorded on the forms that are provided by the Secretary of Health. This includes an indication that the delivery of birth was by a gestational carrier and the identity of that carrier. An order of the court establishing parentage is required to be attached to the forms that are provided by the Secretary. And when those forms that are provided by the Secretary in the order of court establishing parentage, the Division of Vital Records is required to seal those forms and register a certificate of birth in accordance with the order of the court. According to the fiscal note, this is codifying current practice. The cross-file of the bill has passed the Senate. We are in possession of the Senate cross-file as well, and it's in the same posture as this bill.
Are there any questions or concern regarding this bill?
Move the bill.
May I have a second, please? It's been seconded by Delegate Rosenberg. Any concerns or questions? All those in favor say aye.
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 Any opposed? Seeing none, thank you so much. Erin?
House Bill 605 requires the Department of Health to include mental health first aid among the behavioral health services for which the department provides service coordination for eligible veterans. Mental health first aid consists of training for veterans and their immediate family members on how to identify and respond to signs of mental illness and substance use disorders. Each entity teaching a mental health first aid course is required to report to the department the number of veterans and their family members who took the course. By June 1st of 2023 and each year thereafter, the department is required to report to the governor and the General Assembly the total number of veterans and family members who took a mental health first aid course and the total number of courses that are taught in the state. This is another bill that has passed the Senate, and we are also in possession of the cross-file.
So members, according to the fiscal note, page 1, the bill largely codifies current practice and the bill's reporting requirement can be handled with existing budgeted resource. Are there any questions or concerns that you may have? Seeing none, may I have a motion, please?
Move the bill.
May I
Second.
have a second, please? It's been moved and second. Any questions or concerns that you may have? Seeing none, all those in favor say aye.
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 Any opposed? Seeing none. And I believe this concludes our work for today, Erin. Am I correct? Okay, I can hear you.
Yes, you are correct.
Okay, thank you. So members, we're going to meet on Tuesdays. Like today, I want to thank Melissa and Erin and Edith. When we are scheduled earlier, we usually are going to meet right after session. So if you can just plan to just right after session, power up your computer, and I'll try to move us quickly so that you can have lunch. Thank you so much for your help today. It is 11:58. I hope you get to have lunch. See you soon. Bye.
Okay.